Let's get started. So I'd like to welcome Dr. Jessica Adler, who's from Florida International University in Miami, and she's the assistant professor in history of health policy and management. Did I get that right?
In history, yeah, that's exactly right.
So thank you so much for joining us today. And yeah, please give her a round of applause.
Thank you all so much for being here. I want to thank the U.S. Health Science Center Libraries for inviting me. Jane Morgan Daniel has done an excellent job organizing all of the events, it seems, throughout for this.
No,
that's a team effort.
I've been on vacation.
But I'm really proud and honored to be part of the slate of events surrounding the For All the People exhibit that's on display here at UF. I want to extend thanks to the co-sponsors of that exhibit, which is the National Library of Medicine and the National Institutes of Health. I'm grateful that these federal agencies devote resources to the study of the history of health and healthcare. And thank you all for sacrificing your lunch hour to be here with me today and to be active and engaged participants. I appreciate your presence. So it is, as I mentioned, an honor to be here in the library of a premier medical program, a premier public health program. It seems to me that over the last decade or so, many medical schools and colleges of public health have recognized the importance of making sure that students learn about healthcare and health systems, how they work. Textbooks with titles like Health Systems Science focus on different components of working health systems, themes like financing and health information systems, leadership and management techniques. But these sorts of books and sometimes the classes that we offer on health policy and health systems don't leave much space for considering history, and they don't leave much space for considering the actions of individuals. And these, to me, are the major factors that explain changes in health systems over time. So exhibits like the one that is currently being hosted by UF make the case that our medical and public health students, and really our medical and public health practitioners, should consider, at least consider, how social activism shapes policies and systems. So here, the National Library of Medicine's For All the People exhibit, in my view, ideally serves not just as a sort of artful representation of battles fought by others long ago, but instead serves as a way to gain insight into how individuals can and continually do shape both health policy and healthcare. So that last point connects with the goal of my talk today. I'm going to tell you about one moment when a group in the United States, military veterans, advocated for access to an expansive medical system. And I'm going to propose some ideas for what we can learn about this specific, what we can learn about healthcare and health activism from this one specific case study. So I want to go back in time now, which is what you're all here to do, I know, to a few months after World War I. And I want to direct your attention to the image on the slide. You can see from the caption at the bottom that this cartoon is from the Comeback, which was the official newspaper of Walter Reed Hospital, what became Walter Reed Army Medical Center, in right after World War I. And this is from February 5th, 1919. Walter Reed is, of course, a flagship military hospital. And at this moment in time, there are thousands of patients being treated at Walter Reed who had just returned from World War I. So when you look at this picture, I wonder, looking at the title, looking at the figures, who do you think the figure in the middle is supposed to be? Uncle Sam. How does he look? He looks like he's seen better days. Okay, so he looks a little bit thin. He's haggard. His hat is worn out, right? Some of you notice that he looks almost sinister. What about the figures on the side? Who do you think they're supposed to be?
The noble soldiers.
Okay, good. Noble, young soldiers. And what physical condition are they in?
Not good.
They're injured, right? But you can see that the expressions on their faces are hopeful. They're smiling. They are looking ahead, right? They're looking ahead to a future, and given the title, they're looking ahead to a future where they will have the support of their government, which here is referred to as the greatest day. As we know, Uncle Sam is often represented as a figure of the United States government, a sort of, an embodiment of the federal government. So today's talk focuses on the birth of a federally sponsored health system that was justified in part based on the ideals that you see here in this cartoon, that veterans were worthy of support from their government and could depend on it. But it also focuses on the attacks that the health system endured about a decade and a half after this cartoon was published, when sympathy for veterans was considerably more measured in the 1930s at a moment when the United States was grappling with the economic impact of the Great Depression. So I hope that you leave here understanding two big points. First, it's oversimplified and really somewhat inaccurate to argue that a massive system of government-sponsored health care for veterans was established and expanded solely because the United States was committed to providing care for those who had borne the battle, and that's, of course, Abraham Lincoln. In fact, the existence and growth of this health system was hotly contested, both in the interwar years, as you'll see today, and throughout much of the 20th century. Veterans retained their right to access to health care because they, just like the people featured in the National Library of Medicine exhibit, they fought for that right. The second thing that I want you to leave here understanding is that examining historical case studies like this one and like the ones that are featured in the exhibit that is hosted here at UF, doing that sort of examination can teach us really valuable lessons about advocating for change. So I'll end by proposing ideas about how the arguments, historical conditions, and political realities that shaped the veterans health system could inform healthcare activists aiming to expand access to care now in the 21st century. Okay, so just to give you a sense of where we're going, I'll move on now to providing some context for this story, talk to you about why I think it matters, and how we can think of it in relation to other big topics in American history. In the second part of the talk, I'm going to show you some charts, some data, because we're in the College of Medicine and Public Health. We should look at charts. And those are intended to show you just the exponential growth that took place in this health system in the 1920s. In the third part of the talk, I will focus on the political debate surrounding this health system by the 1930s. And finally, I'll close, as I said, by discussing some implications of the case study for how we think about health activism now. Okay. So before continuing back on our journey back in time, I want to provide a bit of context. So as I've noted, I think this story can teach us something about healthcare activism and advocacy, right? But it also relates to current events, and it also relates to at least three big topics in American history. So first, current events. We are obviously living in a moment when the proposal for federal intervention in healthcare generates hostile and tense political debate, right? And we're also living in a moment when policymakers are constantly debating the nature and the structure of government-sponsored veterans health programs and considering more strictly limiting access to those programs. So what we see in the 1920s and 30s is a sort of very rare case study of how and why the idea of establishing a pretty big federally sponsored medical entitlement won. How did that idea actually be how was that idea put into place at this particular moment in time? And we don't have that many examples of this sort of thing happening at other points in time. This story is also important because it helps us understand the roots of a really important modern institution. The Veterans Health System, established in the 1920s, was, as I sort of suggested, one of the country's first and most lasting medically focused entitlement programs. And it continues to exist in expanded form today in the Veterans Health Administration within the Department of Veterans Affairs. So this moment that I'll talk about really explains the beginnings of what we now know as the Department of Veterans Affairs. So now the VA serves more than 9 million beneficiaries through its health system specifically. So as you'll see, some of the questions, the controversies, and the debates that arose surrounding veterans' health care in the interwar years are echoed today. These big questions about how do we determine if an illness or injury is service-connected? How do we improve systemic quality of care? Who should be eligible for benefits? All of these questions that still plague the veterans' health system were brought up more than 100 years ago when the system was first established. Okay, so I mentioned that the story relates to current events and debates about health policy, but I also want to point out that it relates to at least 3 big areas of American history. So by understanding kind of the way historians talk about these other big topics, we can get a better sense of why this story matters and how it matters. So the first area of American history that I want to just quickly give you an overview of has to do with veterans in the state. So World War I is a really important turning point in a much longer story about a special relationship between veterans and their government. So we know from a lot of work on the 19th century and the Civil War that increasing numbers of veterans gained access to pensions and they gained access to soldiers' homes in the 19th century. Soldiers' homes are much more like what we now think of as nursing homes in the late 19th century. And historians have long viewed the World War II era, when we know the GI Bill came into being, as a watershed moment for veterans and their relationship with the government. This is a set of benefits that really gives veterans access to the middle class. There's home loans, there's job training. And so what you are going to learn about today is the sort of bridge between those 2 periods. Like the World War I benefits that I'll talk about are a huge expansion on what happened in the Civil War period and a sort of foreshadowing of what's to come during and after World War II. So it's in this period that an exclusive, publicly sponsored medical system is established, and it's path-breaking. And that's because it provided many former service members with a direct, personal, and really a long-term and institution-oriented connection with their government. So it's very different to have access to federally sponsored medical care from the time when you're 21 until the time that you die than it is to just go down to your local pension office and pick up a check, or to only have access to nursing home care when you're elderly. So this is a big expansion of veterans' benefits. Okay, so veterans and the state. Now the second area of U.S. history that I want to talk about has to do with social and welfare policy. So broadly speaking, the 1920s is widely viewed as a sort of moment of fiscal conservatism. This is a moment dominated by Republican presidents and legislatures right after World War I, when there had been a tremendous expansion of the government, and this is when people like President Warren Harding call for a return to normalcy. So this story sort of calls that interpretation into question, right? We see this expansion in government in this realm. But still, I want to point out that at this moment in the 1920s, the concept of federal involvement in healthcare is not entirely new. This is not the first medically focused program that the federal government is involved in. So in the 18th century, the federal government, we know, established what's called the Marine Hospital System, and this is geared at making sure that a population of merchant marines, these are federal workers who often travel abroad and could come home and threaten the rest of the population with diseases that they newly harbored. So these marine hospitals are set up in order to provide safe havens where these people can be treated. And then in the 19th century, the federal government also becomes involved in providing care for populations that were seen as potentially overwhelming for local systems or for state systems. And these are American Indians, former slaves, and people with mental illnesses. So federal involvement in the health realm, as I said, is not new in the 1920s, but the Veterans Health System represents a big adaptation and a big expansion of government capacity in this realm. At this moment, we see something relatively new. We see policymakers becoming convinced and arguing effectively that ensuring access to medical care can actually enhance economic security. And that's a different type of argument than had been made before. We see them argue that access to this veterans health system can make people better able to sustain a job and better able to be productive citizens. So on that basis, they supported the establishment of this veterans health system. So on a more general level, just one more note regarding social policy, is that this health system really gives us a clue about how rights and privileges were earned in the 20th century United States, or how they were won in the 20th century United States. So as I mentioned, this is one of the first medically focused entitlement programs, and it's a big expansion of the reach of the government. But at the same time, it further entrenched this ideal that one could gain access to entitlements by being a member of a certain group, right? And the U.S. government would award entitlements selectively. And we see that, of course, becoming a defining feature of federal assistance programs in the United States. You think of Medicare, intended for the elderly. You think of Medicaid, intended for the poor. Both programs established, of course, in the 1960s. So I just want to take a moment to point out that we often hear of veterans' health benefits referred to as entitlements, just like we hear that word used for other health benefits as well. But I just want to note that that word can be very misleading. To study the administration of VA healthcare in this period and in others is to study poverty in the United States. So we'll see here in the records of the VA, we find a window onto the need that dominated the lives of the people who were supposedly entitled to the care of this system. And we also see the demands that these people placed on their government. And we notice that VA and federal officials were determined to place conditions and limits on what we call entitlement. So I just want to point out that entitlement can be a more sort of positive word than it might actually be in terms of the way it's lived out by the people who supposedly have access to it. Okay, finally, one more topic in American history that I want to give you an overview of. And that's the history of health and medicine. So it's important to understand that up until the 20th century, as I'm sure some of you in this room know, hospitals in the United States are widely seen as dens of dependency and not anywhere that you wanted to go if you were a middle or upper class American. But in these years that we'll talk about today, hospitals are newly seen to actually be ideal sites of care. That has to do with a variety of factors. There are breakthroughs in understandings of how germs are transmitted, breakthroughs in how to create a sanitary environment for surgery. There are new technologies like the X-ray that are only available, of course, in institutions. And there are new social conditions. People are living in cities more and more, and it's just easier and more feasible to seek care outside of the home than inside of the home. So this is the first time that we see middle and upper class patients, the first few decades of the 20th century, actually wanting to seek care in hospitals. And so that bigger trend is a big part of the story of veterans health care. So this is the first moment when we see veterans want access to hospital care in a much more real way than they had in the past. This new generation of service members had experienced a more expansive military hospital system because of these innovations. New specialty areas in physician practice came into being, and these physicians fight for their specialties to be represented both in the military and veterans health system. And so all of these larger trends in medical history and in the professionalization of medicine help to shape the debates and the demands that you'll hear about today. Okay, so one more point to recognize regarding medical history is that in the first decades of the 20th century, again, a trend that you might know about, is that chronic illnesses overtake epidemic diseases as the primary health threat for Americans. And this, of course, is the mark of a wealthy society, right? When chronic illnesses begin to overtake epidemic diseases as the primary health threat. And that trend, too, is mirrored in the veterans health system. What we see in veterans hospitals, as you'll notice in a moment, is that most of the people who are being treated in these veterans hospitals actually have chronic conditions rather than these visible battlefield injuries that you might more typically associate with war. So we're talking about things like neuropsychiatric illness and tuberculosis. Okay, so now that you have some context about why this story matters, how it relates to bigger areas in American history, I want to move on to the second part of the talk, which is just going to demonstrate for you the tremendous growth in the veterans health system that took place in the 1920s. So the first chart that you see here shows the growth in the number of veterans hospitals in the interwar years. So 1917, when the United States enters the war, is not on here because there were 0 so-called veterans hospitals at that point. As I mentioned, there's a system of soldiers' homes, but really, World War I veterans and their advocates viewed those post-Civil War institutions as antiquated, anti-scientific, and in fact, some of the first veterans hospitals were founded in part because of negative views of those soldiers' homes. So by 1924, you can see there were more than 40 veterans hospitals, and by 1933, every state, almost every state, had at least 1, if not 2, veterans hospitals. So I'll talk a little bit more about how and why these institutions came about a little bit later in the talk, but for now, the main takeaway point, obviously, is that between 1919 and 1933, legislators and public health and veterans advocates built and expanded a tremendous network that became known as the Veterans Health System. So the agency that ran this health system was established in 1921. It's called the Veterans Bureau. In 1930, it grew to become the Veterans Administration. So even though during some of the years I'm going to talk about today, this government agency was called something other than the VA, I'm going to just use the term VA for ease of terminology. Okay. So, continuing on to the second of our 3 charts, showing the growth of the Veterans Health System in the 1920s. So, what we have here is a picture of the number of veterans remaining under treatment by health condition from 1919 to 1939. And as you can see, there are 3 major categories of patients. This is how they were classified by the VA. And this last category that you see here, general, could really basically be considered anything that was not neuropsychiatric or tuberculosis. This could be like the after effects of injuries and illnesses. This could be any sort of illness or injury that was not classifiable under the first 2. So you see here, obviously, that neuropsychiatric conditions are by far the most pervasive from 1924 on, and we can talk more about possible reasons for that during the Q&A if you're interested in that. But for now, I want to keep focusing on the growth of this system. Now, since part of the talk today focuses on hostility towards the Veterans Health System, I want to point out a factor that helps to bring that hostility about. And that is the fact that the Veterans Health System, back then, just like now, was tiered. And that is, patients were divided into service-connected and non-service-connected disabilities. And as you can see here, which is the category that has more patients? Non-service connected disabilities. And you can see that those numbers increase tremendously over time. So government rules that are put in place in 1921 when the Veterans Bureau was established dictated that veterans who had illnesses or injuries that the VA judged to be service-connected, in other words, they had originated when the service member was serving, they could have access to publicly sponsored veterans health care. Legislation passed 3 years later, in 1924, expanded access to care to honorably discharge veterans who had non-service connected disabilities or who had conditions that had been aggravated in service. And these are terms that are familiar because they're still used today. So beneficiaries who weren't classified as service-connected, even after 1924, supposedly had to pass a means test, and that meant they had to show that they didn't have the income to get treatment outside of the VA. That policy, it seems from the records, was very variably enforced, right? So if a hospital administrator was lenient, that hospital might have non-service connected people being treated even if they had not proven an economic need. But as you can see here, this chart shows that as the VA grew in the 20s and 30s, more and more beneficiaries are classified as having non-service connected conditions. As some of you can imagine, based on debates that are still raging today, some of the people classified in the red non-service connected category definitely believed that they belonged in the blue category. And so some of this has to do with how was the government changing its rules over time. But the important takeaway point is that this is the perception of the American public, right? Is that we know, we think, and it seems that most of the people being treated in this system have non-service connected disabilities. Okay, so just some data to get you oriented into what's happening in the Veterans Health System at this time. Now I want to move on to the third part of the talk, which has to do with the 1930s and people's perceptions of this health system during the Great Depression, and some of the political debates that took place surrounding this health system. So I want you to keep the last chart in mind, the non-service connected and service connected charts. And I want you to sort of observe this cartoon. This is actually drawn and written by two patients who were covered by the VA, but being treated at Walter Reed Hospital in the 1930s. The VA sometimes paid for care for patients or beneficiaries at institutions that were outside of the Veterans Health System, and that was the case for these authors. And you can see the bottom says that that these men are in a veterans hospital. They are waiting in line for movie tickets, and you can see the bubbles over their heads too suggest they're commenting on the looks of a nurse. And the bubble over the last gentleman, you can see he says, "I've seen 4 shows this week. I guess I can stand one more." And the text at the bottom too suggests that it says, "This treatment is considered very beneficial. The aches and pains get a recess, congressmen relax, and the boys get away from it all for a few hours. Hurry back, comrades, or you'll lose out on supper." So if you think about this, you could see how this could be representing the Veterans Health System as a place where people who want to live free and easy off the public dime are finding great possibilities for fulfilling that hope. So I want you to imagine how you might have perceived this cartoon if you had not held a job, let alone seen a doctor or seen a movie for months, right? And this is actually hardly an unusual viewpoint at the time of the Veterans Health System. Many people are feeling down and out. Many people are feeling like they'd like access to the same benefits that veterans have, and that they're being locked out of this sort of privilege. So in the early 1930s, as the VA is serving an increasing number of patients in the midst of the Great Depression, skepticism of the system, of its beneficiaries, of its institutions, its hospitals, really expanded. So one of the most vocal groups in this camp was the American Medical Association, or the AMA, which was the premier advocacy organization, of course, for U.S. physicians. So you can see in the top article a clip from a 1926 article of the Journal of the American Medical Association, and it's typical of the attacks that the organization was waging in the 1920s, centering on the notion that free medical care for veterans constituted really an ideological and perhaps even more pointedly an economic threat. So the article, as you can see, references the 1924 World War Veterans Act. I mentioned that the Veterans Bureau was established in 1921 and that 1924 legislation expanded access for people with non-service connected disabilities. We can talk more about how that piece of legislation came about, but for now it's just important to know that it drew tremendous hostility and skepticism from the AMA and from others. The AMA, of course, feared that the system threatened the jobs of doctors, and the more people that were covered by this system, the more of a threat that it posed. So the rhetoric that you see here, of course, that term state medicine, implied the existing threat of socialism, communism, and if it seems familiar, of course, it's because the AMA used this sort of rhetoric throughout the 20th century as different pieces of legislation called for more federal involvement in healthcare. So I want to point out that while the AMA was really powerful, there were plenty of professional doctors who disagreed with the stance that that organization took against the growth of the Veterans Health System. You can see here a clip from the Journal of the National Medical Association, which was the national organization representing black doctors. And the NMA takes a very different stance. This isn't about communism or anti-communism for black doctors, but instead we can really actually think about discussions about veterans health care for black doctors as touching on at least 3 different areas of debate within the black intellectual community in the 1920s. So the first area of debate that veterans health care touches on has to do with jobs. Like first, for black doctors, like everybody else, needed jobs in the Great Depression. But unlike leaders of the American Medical Association, NMA directors viewed the VA as a potential source for work, not a threat to jobs. They lamented actually the underrepresentation of black doctors in the highest positions within the VA. And all of this, of course, made sense given that in Jim Crow segregated America, opportunities in the private sector were considerably more limited for black doctors than they were for white doctors. So government work was a bastion of opportunity. So that's the first area, area of concern for black intellectuals having to do with veterans health care. The second has to do with the fact that black doctors drew attention to veterans health care as a potential place where African Americans could seek better health care than they might have access to in general society. And again, they view the VA as a potential source of high-quality professional care in a world where other options were seriously limited. And this is a very different view from the AMA, which often represented the VA system as inferior. So finally, the last third area I want to talk about has to do with the debates and merits of integration. So what we see in debates and discussions among black advocacy organizations and black doctors is the call for hospitals to serve specifically black veterans and have only black doctors employed there. And we see in 1924 the establishment of Tuskegee Veterans Hospital, which is intended to serve only black patients. And in the 1930s, the National Medical Association says we need more of those institutions because that's the only way we can guarantee the safety of black patients. And this follows reports of violence in veterans hospitals, reports that doctors are treating black veterans differently than they're treating white veterans. And so it's motivated by very real concerns. The NAACP, the National Association for the Advancement of Colored People, the premier advocacy organization for African Americans at this moment in time, takes a totally different standpoint from the NMA. And they say, actually, integration is the only way to equality. We can't keep fighting for segregated facilities. And so we see this debate about veterans health care play out in the Journal of the National Medical Association. And we see a very different interpretation of what should happen. By the 1940s, actually, the National Medical Association comes around to the standpoint of the NAACP. They say we need to fight for integration. But I bring up these sort of three areas of discussion because I want to point out that there were really wildly different interpretations of what veterans health care meant to different groups. The National Medical Association and other black organizations viewed the VA health system totally differently than a group like the AMA, and so not everyone was on board with opposition to the expansion of this health system. So it's an important point to make. So then, as now, the veterans health system meant different things to different groups, and it depended on your perspective. Okay, so all of that said, the AMA was a very visible and powerful advocacy group, and its stance was highly visible. It wasn't universal, but it was hardly unique. So skepticism of the VA and its health system wasn't limited to these white doctors. It extended into the highest reaches of the federal bureaucracy. So in 1932, the head of the VA, Frank Hines, wrote to the Surgeons General of the Army and the Public Health Service and others with knowledge of the issue to ask whether they supported more strictly limiting access to this system. And these are letters among, federal bureaucrats that are not in the public record at all, because speaking publicly against the veterans health system is very different than speaking privately about perhaps more strictly limiting access to it. So this is private correspondence between federal officials. So each of these Surgeons General and these officials say, yes, we need to more strictly limit access to this health system. So the Army Surgeon General said, actually, for veterans with non-service connected conditions, they should be treated by, as he put it, local civil charitable organizations that handled other indigents and those in the vagrant class. So you can see this sort of grouping of non-service connected veterans with other poor Americans. So lots of business groups are on board with this sort of view, speaking out publicly against the veterans health system. And they start to argue that veterans benefits should be really strictly limited to people with service-connected disabilities only. So 2 weeks after taking office in 1933, Franklin Roosevelt made it clear that he actually fully agreed with the bureaucrats that you just heard from. Before fulfilling his promise to offer relief to Americans via the set of programs we now refer to as the New Deal, he focused on cutting the deficit. So what Roosevelt does, his first thing in office, his first act in office is, one of his first acts is to pass the Economy Act. So this is aimed at two populations that are seen as particularly costly for the federal government, and that is veterans and government workers. And so for veterans, there is a tremendous impact on the health and pension program of the VA. You can see from the quote here that this repeals a variety of veterans benefits laws that had been enacted since 1924. A subsequent executive order made it clear that people with service-connected conditions could be treated by this federally sponsored system, but anyone else had to see their way out. So there are plenty of supporters of the president's drastic legislation. Frank Hines of the VA wrote that it could be viewed as a sort of corrective. He said, after all, the VA had probably gone too far when it came to offering health services and other benefits, regardless of whether or not somebody's condition or illness was service-connected. So individuals and organizations also supported the Economy Act. You can see the quote on the slide shows an excerpt of a letter that somebody wrote to their local congressional representative saying that veterans, one person said they were tired of the so-called self-serving patriotism of the veterans lobby. So these people in Depression-era United States very much viewed veterans as just like them, part of the down-and-out American populace. Okay, so the President's directives in the Economy Act have a swift and pronounced effect on the veterans' health system. 3 months after its implementation, the total number of hospitalized veterans decreased from about 43,000 to 33,000, so that's a decrease of about 23%, and about 90% of that big decrease is among people with non-service-connected disabilities. So these people are ushered out of these veterans' hospitals. All right, so because I'm a historian, I have to talk about both sides of the story, or as many sides of the story as possible. And I want to point out that in letters to Congress, telegrams, people also voiced their extreme opposition to FDR's very drastic policy. They indicted groups like the American Medical Association and Chambers of Commerce for their lack of sympathy, and they used this language that's very much in the public sphere at this point, referring to themselves as poor and working class Americans. People like Smedley Butler and Wright Patman are talking at this moment in time about the fact that World War I was fought on the backs of working Americans and that it had really been a sham, right? And so you see in these veterans' individual letters, they're adopting that language and they're saying this is just more of this sort of hoax on the American people.
I love the big appropriations and refunds to banks and railroads, and I'm all like, that can be 5 years ago.
That's right. Maybe not railroads, but maybe but still, the general point is right. Exactly. So I mean, that's part of the interesting, takeaway in this story is that there is so much that can be applied to present day and other periods as well. Okay, so by depriving those in need of hospital and nursing home care, veterans said the Economy Act robs them of an earned right. Veteran residents of a National Soldiers Home in Washington, D.C. told legislators that they had been forced to pay out of pocket to remain in the home where they had been living up until that point at an expense covered by the government. And they said that was unfair. This is a quote. They said, the privileges of the home was one of the inducements of our enlistment. They had what they called an implied contract with the government to receive services at the home free of charge. So they're saying, okay, you've got this Economy Act, but there were lots of laws in place when we enlisted, and we were guaranteed access to soldiers' homes and care. Okay, so if claims of injustice weren't enough, veterans also used pragmatic economic arguments, and you can see that in the last quote on the slide. And they basically made the argument that if the federal government shirked its responsibility to care for them, they would become charges on their local communities and on their states. Spanish-American War veterans, who are at this point elderly, made particularly strong arguments in this respect. Members of an Iowa chapter of the United Spanish War veterans argued that cuts in federal benefits equated to shifting the burden from the government to the city and county taxpayers. And of course, the powerful argument here is that when you're in the military service, you are an employee of the federal government and not working for your county or your state in most respects. Okay, so I want to just come back to that idea of service-connected and non-service-connected, because many former service members at this time who had been classified as non-service-connected took particular issue with the Economy Act and its focus on that, on them as a population. They believed, many of these people believed that their conditions had, in fact, been due to service, and they didn't like being told that they were now not eligible for these benefits, right? So 100 Kansas veterans wrote to their member of Congress saying, how could FDR slash their benefits even as they suffered from these debilitating long-term conditions like malaria, diabetes, arthritis, deafness, and stomach ulcers? These ailments, these veterans said, were directly traceable to their time in the Philippines and Cuba. They pointedly asked, and this is a really telling quote, did anyone serve 3 years in the Philippines and not incur any disabilities, right? And we see this still with our veterans now. I mean, serving anywhere, even if you're in a domestic camp, there are things that happen, and it's really difficult to prove the origins of an illness or a disability. So this is a continuing issue. So these and other Spanish-American War veterans argued that it was really especially difficult to prove that their health problems were due to service because of the nature of these ailments and because they lacked access to their medical records. And by linking access to benefits strictly to service connection, these elderly veterans told legislators, the Economy Act, quote, humiliates us by making us objects of charity. Okay, so the archives actually show that veterans in the 1930s should have been worried. So you see here letters written by veterans in 1923. This is a moment when the system was much less accessible. I mentioned that hospitals were not officially open to people with non-service connected conditions until 1924. So this is the moment right before that. And these letters show that veterans at this point are fighting for care and services. They told VA officials that they were unable to work, and they requested reimbursement for treatment of back problems, respiratory ailments, and lingering effects of gas poisoning. So these people are saying, we're not eligible for care, but we think our conditions actually warrant federally sponsored care. So 10 years later, at that moment in the 1930s, after the passage of the Economy Act, veterans who had non-service connected disabilities dreaded being placed in similar situations and being locked out of the system. So the arguments of the Economy Act naysayers and the well-publicized tales of neglect that advocates argued resulted from this draconian policy led these new rules to be overturned actually almost as quickly as they had been put in place. Congressional Democrats who were very concerned with pleasing veteran constituents passed legislation over President Roosevelt's veto, stipulating that the VA could again care for veterans with non-service connected disabilities. So by the summer of 1934, many veterans benefits, including access to medical facilities, had been reinstated to pre-Economy Act levels. So the impact again is immediate. By late 1934, VA hospital rates had risen by 19%. So that original decrease is almost completely compensated for a year later. And virtually that entire increase took place in the population with non-service connected disabilities, which went from about 19,000 in VA hospitals in 1933 to 27,000 in June 1934. So we see that the same decrease occur in increase a year later. Okay, so I want to finally get to closing, and I promised that I would share some takeaway points from this case study and discuss what we can learn from it about health policy, about health advocacy. So first, on the simplest level, the interwar struggle over veterans' health care really highlights the difficult, maybe impossible questions that arise surrounding government responsibility to people who serve in the military. It is really hard to set limits, rational limits, on people's care and on how you define service connection or not. But I want to propose today that the veterans' healthcare system and the story of its establishment can teach us more about issues beyond the veteran population. So from it, I think we can draw conclusions about which arguments, which historical circumstances, and which political conditions lend themselves to health policy change. So first, what can we learn about effective arguments? So veterans advocates convinced legislators to establish and then to strengthen a massive federally sponsored health system by making public health, political, and economic arguments. So part of the reason why we see the veterans health system grow in the 1920s, why those charts looked the way that they did, was because public health officials testified in Congress alongside veterans advocates, and they argued that increasing access to care for veterans was a medical necessity, and not just for people who had served. They pointed out that the health threats that veterans faced, especially long-term chronic illnesses like tuberculosis and mental illness, could actually impact their fellow citizens, right? And this is, you can think back to the Marine Hospital Service, and this public health-oriented argument is very effective whenever it comes to federal intervention in healthcare. So many of the public health officials who support veterans health care in the 1920s had been longtime advocates for more federal presence in guaranteeing workers' health. And they see this federal system as a sort of wedge into that larger project. But it sort of underscores the power of the public health-oriented argument. So what other types of arguments do we see in the veterans health case study? We see black veterans, as I suggested earlier, really effectively capitalizing on this public health-oriented argument. On an individual level, they're writing to VA central office and they're reporting on the conditions that they're experiencing in veterans hospitals. And they are joined eventually by black advocacy organizations who set up meetings with VA officials to point out the injustices in the system. And so as they are making these salient rights-based arguments, they are, in fact, growing the purview of the veterans health system, and they're making it more egalitarian. So we see the veterans health system desegregate earlier than other veterans hospitals, and we see the VA system sort of being forced to more willingly offer care to more veterans regardless of race. So that's another type of argument, rights-based, politically oriented argument. On the other side of the political spectrum, we see conservative veterans groups like the American Legion fighting for expanded access to care for totally different reasons. We see that they are concerned about former service members falling victim to political radicalization by more left-leaning groups. They're worried that these people are going to become socialists, they're worried that they're going to become communists, and they see free access to medical care as a way to defend against those dangerous ideologies. So that's a totally polar opposite argument for why expanding access to care can actually be beneficial. So you're getting a sense of the diversity of the arguments. So notice that I haven't mentioned one seemingly obvious argument, which is that veterans were uniquely needy and worthy, right, because they had served. The veterans case demonstrates why that sort of moral and ethical argument can be a bit tenuous, right? We know that by the 1930s, federal officials are calling into question the worthiness of veterans. They're referring to them as indigents and vagabonds. So in the 1920s, too, as veterans hospitals were being constructed, legislators really expressed doubt about the legitimacy of so many claims on state-sponsored care. They asked, what about those who have never shipped abroad, but they got tuberculosis in a stateside camp? What about those who have less than valiant service records? Are they particularly worthy for access for the rest of their lives to this health system? So facing those sorts of difficult questions and understanding the inescapable reality that one person's definition of worthiness is different than another person's, veterans and their supporters recognized that pragmatic arguments were the most powerful and persuasive. They told legislators in the 1920s that access to care could enable veterans to more readily return to work, to be productive citizens, to be productive fathers, husbands. And in the 1930s, as we've seen, they argued that if the VA restricted eligibility and left them untreated, they would become burdens on their local communities. So all of this is to say that a variety of constituencies presented really convincing public health, political, and economic arguments for making publicly sponsored health care available to more veterans. And the takeaway point here is that expanded access may be most likely to become a reality if it's sort of ideologically malleable, if diverse interest groups can support it, even if for diametrically opposed reasons. All right, so in addition to highlighting types of arguments that work for justifying an increase in federally sponsored care, the story that you heard today also offers insights about historical conditions that lend themselves to an expansion in access. So during the 1920s, when veterans initially fought for the establishment of a veterans hospital system, very few people actually understood the very difficult political questions and the high economic costs that establishing that system would entail. So in fact, in the early 1920s, providing access to health care for veterans was seen as a sort of safe and affordable way to demonstrate support for veterans. It's only in the 1930s that we see social scientists begin to really study in detail the actual costs of medical care. And at that time, that new work helps to bring about a sort of public reckoning about how much of a problem, I mean, they didn't call it access to care then, but how much of a problem access to care posed for many Americans who, evidently, according to these reports in the 1930s, couldn't afford this and didn't have the ability to get. So this new work helps to bring about this public reckoning and helps to explain FDR's call for cuts in benefits. So historians don't really like to engage in counterfactuals, what if this, then this, but to me it seems that this moment of the 1920s is really unique in terms of I don't know that this system might have become a reality at any other moment in time, because we have a moment when hospitals are newly seen as ideal sites of care, and we also have a moment when people are relatively ignorant as to their long-term costs. And so this is a sort of conflagration of circumstances that lend themselves to the creation of this health system. So I guess the takeaway point from this is that blissful ignorance about a health reform is never desirable, but it can help to bring about change. At least that was the case here. Okay, so I also just finally, the last sort of big takeaway point I'll bring up is that I want to discuss just the importance of political conditions, just two small points. So alongside public health and veterans advocates, VA officials testified in Congress in the 1920s for the merits of expanding access to care. They were, and this is actually specifically Frank Hines, who you heard from in the 1930s as very skeptical of this big system. He is part of the force that leads to the expansion in access to veterans health care. And he argues in the 1920s to expand access. He wants to have his hospitals fuller because he thinks it can make them more efficient and more cost effective. And of course, he wants to increase the capacity of his organization. And so the takeaway point here is it helps to have bureaucrats on your side too, right? You need public health officials, you need advocates, and you need bureaucrats, preferably from an agency that is concerned with serving constituents that are going to be positively impacted by an increase in access to care. And then the final political condition I want to mention is that in the case of the veterans health system, advocates and bureaucrats played major roles in drafting the actual policies that laid the roadmap for the veterans health system. Sometimes strategically and sometimes totally inadvertently, they wrote into laws vague terminology that led eventually to expansions in coverage. So for health policy activists concerned with increasing access, the art and craft of writing legislation is a really important part of the process. All right, so finally to close, some see VA healthcare as a godsend, proof that an integrated government-sponsored health system can be effective, and others view it as at best a quagmire and at worst willfully negligent, right? This talk is not about how good or bad the VA is. It is about the fact that when it comes to discussions about what works and what doesn't work in terms of advocating for expanded access to care, a case study of these early years of the veterans health system offers just a remarkable object lesson. It underscores which arguments, historical circumstances, and political conditions can catalyze or really stop health policy transformations. Like the health reforms depicted in the exhibit on display here at UF, the For All the People exhibit, it also validates the idea that working and middle-class Americans can be political actors, that they can influence how health systems work, and more importantly, how and why they change over time. Thank you.
And now moving on to the Q&A. If anyone has any questions, I'd say we have about 5 or 10 minutes.
Sorry, I always ask all the questions.
We're just waiting for it. Every department has one.
I don't know if I'm not one. But you mentioned at the beginning that you wouldn't go into detail about the psychological, the types of things that these people were dealing with. Obviously, I think it's really interesting, like that was something of that historical moment, especially considering today with PTSD and all of the psychological effects that we're really now discovering and recognizing. But the fact that they saw that neuropsychiatric was a huge need, was it all shell shock, or what was it?
Okay, great question. So when we look at this chart, we have to keep in mind a few important contextual points, okay? So first of all, we know that trauma and what we now refer to as mental illness, or there have always been mental repercussions to serving in the military, and especially to being exposed to combat. There's a great book by a guy named Eric Dean called Shook Over Hell, and he writes about a comparison between Vietnam-era veterans and Civil War-era veterans. And the main point is, he looks at the writings of Civil War veterans and those of Vietnam veterans, and he compares them, and he says, basically, even though we might have called a certain syndrome or disorder something in the 19th century and we call it something else in the 20th, the symptoms still are very similar. And this is a case for the extreme power of war to have a major impact on people's mental health, right? So that is just a fact to state, right, that war has this impact. The second thing to keep in mind is more connected with this moment in the 1920s. Legislators are pointing out in the 1920s that they're very concerned that at least some of the patients that are being admitted to these hospitals are seeking care in hospitals because they want higher disability payments. So the VA in the 1920s is not only determining service connection or non-service connection, but also determining percentage of disability. And your percentage of disability, just like in workers' compensation laws in states at this moment in time, is determined by the percent by which you are limited to work based on the disability, right? So if you have limited use of your right arm and you're a violinist or a writer, and you're a righty, you might have a 30% disability. But at this moment in time, given the way the VA policies work, if you checked into a hospital and you had been rated at 30% disabled and therefore had, let's say, $30 payment per month, once you're a hospital patient, your rating goes up to 100%. You get $100 a month. And so this is very much on the minds of legislators at this point. And for them, looking at this chart, they would say, oh, we can explain this by thinking about the compensation policy. People wanted access to care because they were getting higher payments. And it was easier to get a neuropsychiatric classification, which is totally invisible, than to get another type of medical classification. The third thing to keep in mind, in addition to this idea that war has real consequences and that compensation rules might have encouraged people to seek care, is that there are major transitions going on in the field of psychiatry. And you have psychiatrists fighting for really like a legitimization of what had been seen as a sort of bastardized specialization. So you have mental health experts working with the VA to open neuropsychiatric hospitals and to make them, instead of resemble institutions from the 19th century, make them modern institutions where people could seek care and then go back out into the community. And these psychiatrists are doing nothing to decrease necessarily the admittance rates in these neuropsychiatric facilities. But I want to point out that this chart is, of course, connected with this idea of non-service connected. So many of these people with neuropsychiatric illnesses are rated as non-service connected, and that too has to do with trends in psychiatry, right? We know that at this moment in time, psychiatrists now are beginning to do this, to assign mental health problems to experiences earlier in life. So there's this really interesting publication, the Medical Bulletin of the Veterans Bureau, that's published throughout the 1920s. And what they do every once in a while in this bulletin is they publish case studies. And a series of case studies is published in, I think, 1926, the late 20s, and it's from a neuropsychiatric hospital in the Veterans Health System. And it's written by a nurse who's sort of presenting the case study, offering you a view of the military service experience of the patient, the early life experience, etc. And over again, what you see in these case studies is that veterans who had served near the front, one case comes to mind of a veteran who had been kicked in the head by a horse. Horses, of course, were very prevalent near the front in World War I. He had been kicked in the head by a horse. He had been exposed to combat. And still, the classification for him was non-service connected. His mental illness was due to his experiences early in life in New York, not being accepted in schools, having an over-reliance on his mother. And these are explanations that you see over and over in that bulletin. And so I want to point out that even though just the importance of the way that the government defines service connection and what might seem more accurate from the veteran's perspective. So I think, we have so those are the three sorts of explanations: the history of psychiatry, compensation, and the impacts of war. Yes.
Can you tell us more a little bit about the FDR Economy Act? I mean, this is really brutal. Does this happen quite often in the public health policy? You just come and remove one thing?
Right. It's a great question. I think that the Veterans Health System itself is so unique in its expansiveness that the answer is no. This doesn't happen a lot in public health policy because there aren't a lot of programs like the VA health system, right? And so what we see in this, what we can take away from what happens with the FDR case is that once an entitlement is put into place, especially once an agency is created to make sure that that entitlement is actually administered, it becomes really difficult to reverse that, right? Just like you heard the veterans say in their fight against the Economy Act, we were guaranteed this, right? The government already said they would do it. It's already a law, and so you can't go back on it. And so, I think anytime you see, you could also, there's so many different ways to think about this, and it's a great, interesting question. We see this with the Affordable Care Act, right? We see the passage of this act very different in nature from the Veterans Health System, but we see constant attempts to rein it in and to roll it back. And so, on the one hand, you could say the Veterans Health System story, the Veterans Health System itself is so unique that we can't, that FDR's initiative, there's nothing else like it. But we can also say that there's a constant push and pull in the history of federal health policy, fighting for and against government intervention, and the passage of a law does not mean that the people who are against federal intervention stop fighting back. So,
and merely on these circumstances of America has just won the Second World War, and the huge impact of the veterans, of course.
Yeah.
This is really weird how we can just launch